Antibody-antigen interactions, which occur in the zone of equivalence to form precipitation, can also be visualized here. In this example, patient's serum is going to be tested for antibodies against a specific antigen. The same amount of antigen is added to all test tubes, and then the patient's serum is added to the first tube undiluted. It is in glycerol, and so these two solutions will not mix except at the interface where they meet. Because of the excess of antibodies in this first tube, no reaction occurs, no precipitate forms. And so the serum can then be diluted by a 1:2 dilution to determine whether a zone of equivalence forms here. And a serial dilution of the patient's plasma can be performed, in which each tube has half the concentration as the tube previous. And at some point, precipitation may occur in a zone of equivalence if the patient is making antibodies against this specific substance. The concentration of the antibodies can even be determined, because the higher the concentration of antibody in the patient's plasma, the greater the dilution one would need to obtain this zone of equivalence. And so one can not only test for the presence of these antibodies, but also their concentration.